Have you ever thought about what keeps your brain working perfectly, moment by moment? It is a continuous, delicate flow of blood. But what happens when that vital supply suddenly erupts, not nourishing but instead causing harm? A bleeding stroke, also called a hemorrhagic stroke, damages the brain when a weakened blood vessel bursts and leaks blood into or around the brain. This sudden bleeding directly harms brain cells and disrupts their normal function, creating an immediate and critical medical emergency. The damage from a bleeding stroke unfolds in several crucial ways. First, the escaped blood forms a clot, known as a hematoma, which occupies space within the skull. This clot presses directly on the delicate brain tissue, disrupting its signals and depriving cells of essential oxygen and nutrients. Second, blood outside of its vessels acts as a chemical irritant to brain cells, triggering inflammation and a cascade of harmful biochemical reactions. Third, this internal bleeding rapidly increases pressure inside the skull, squeezing the brain against its rigid confines and reducing overall blood flow to other healthy areas. This combination of compression, chemical irritation, and increased pressure can lead to widespread damage. Understanding this process helps emphasize the importance of immediate medical attention. If you or someone you know experiences sudden severe headache, weakness on one side, difficulty speaking, or vision changes, calling emergency services right away is crucial. Doctors can use imaging like a CT scan to quickly identify the bleeding and begin treatments to manage the pressure and control the bleeding, which is vital for limiting further damage to the brain. One often overlooked detail is that the brain cells themselves do not have pain receptors, so the excruciating headache many people experience during a hemorrhagic stroke comes from the pressure on pain-sensitive membranes surrounding the brain, as well as the irritation of blood vessels. Early detection of risk factors like uncontrolled high blood pressure is key, as high blood pressure is the most common cause of the weakened blood vessels that can lead to these bleeds, particularly affecting the small arteries deep within the brain. Ultimately, a bleeding stroke harms the brain by an intricate process involving physical compression, toxic chemical exposure, and elevated pressure within the skull. Recognizing its symptoms and acting quickly to get professional medical care can significantly influence outcomes, protecting brain function and improving the chances of recovery by minimizing the duration and extent of this complex damage.